You've been memorizing terms. You've been flipping flashcards. But what if I told you there's a better way to prepare for the LMSW exam? Welcome to your Clinical and Macro Terms Masterclass, the study guide designed to simplify, clarify, and lock in the essential terms you'll see on test day. It is packed with real-life examples, easy explanations, and zero boring textbook lingo. Just clear, helpful insight into the clinical and macro terms you need to pass that exam and thrive in the field. In the world of social work, our mission is clear: uplift individuals, strengthen families, and build healthier communities. Yet within that mission lie two distinct paths: micro-practice and clinical practice. They may sound alike, but their focus and expertise set them apart. Let's begin with scope. Micro-practice is broad, direct engagement. You meet with individuals, guide families, and facilitate small groups. Here, you're the navigator, assessing strengths, linking clients to vital resources, managing cases, advocating for needs, even offering brief counseling. You hold the map and the compass as you help people chart their next steps. By contrast, clinical practice is a specialized subset of that work, an intensive journey into mental health assessment and psychotherapy. Clinical social workers diagnose challenges, craft comprehensive treatment plans, and provide ongoing therapy. They draw upon evidence-based interventions to guide healing, one session at a time. And what about language and tools? In micro-practice, you sketch genograms and eco-maps, conduct psychosocial assessments, apply systems theory, and build service plans anchored in client strengths. These tools help you see the whole picture: how relationships, environments, and resources intersect. In clinical practice, your toolbox deepens. You master DSM-5 diagnostics, create biopsychosocial formulations, and deliver targeted therapies, CBT, DBT, psychodynamic approaches, under the watchful guidance of clinical supervision. Here, precision and therapeutic technique blend to promote lasting change. Finally, training and credentialing. Every social worker learns core skills in generalist programs, those foundational strengths of micro-practice. Licensure requirements vary by role and state. Yet to practice clinically, you embark on an advanced track. An MSW clinical concentration, hundreds of supervised hours, and the pursuit of LCSW, or LICSW credentials. This journey refines your expertise in mental health diagnosis and treatment. In short, all clinical social work is micro-practice, but not all micro-practice is clinical. Clinical social workers carry that essential foundation into a deeper realm of diagnosis and therapy. So whether you are guiding a client toward community resources or sitting across the desk for a therapy session, remember, your work matters. You're the bridge between struggle and strength, and both paths lead toward hope, healing, and transformation. Now, when it comes to some terms you need to know as a social worker, we will start with clinical terms. 1. Countertransference. Ever have someone remind you of an old friend or ex, and it messes with how you treat them? Yeah, therapists deal with that too. That's called countertransference, when a social worker has personal feelings that creep into the professional space. When this happens, it's a good idea to check in with a supervisor. 2. Transference. Now flip it. When clients start treating us like we're their parent, partner, or someone from their past, that's transference. It reminds us that every relationship carries history. As social workers, our task is to hold that history with care, curiosity, and compassion, turning projections into pathways toward growth. By recognizing and working with transference, you transform a potential stumbling block into a powerful tool. You help clients rewrite old scripts, discover new ways of relating, and heal wounds they once carried in silence. 3. Dual diagnosis. Two things going on at once. Usually a mental health issue and a substance use disorder. Like someone dealing with depression and alcohol addiction. They both need to be treated at the same time. 4. Dual relationship. Ever realize your client is also your neighbor's cousin? If you know someone outside of therapy and they become your client, that's a dual relationship. It is tricky territory, so when in doubt, consult. 5. Egosyntonic versus ego-dystonic. These sound fancy, but stick with me. Egosyntonic means the behavior feels right to the person. Like a narcissist thinking their behavior is totally fine. Ego-dystonic means it feels off or wrong, like someone who's anxious about their own intrusive thoughts. 6. Empathy. This is your superpower. Empathy means truly getting what someone is feeling and showing them that you do. 7. Empowerment model. Instead of doing things for the client, we help them realize they already have the strength to do it themselves. You're not their savior. You're their cheerleader. 8. Evidence-based practice. Basically, use the methods that actually work, are backed by research, and align with your client's preferences. 9. Informed consent. Before starting treatment, the client needs to know the deal, risks, benefits, and what they're getting into, and they have to agree to it willingly. 10. Self-determination. This one's huge. Clients get to make their own choices, even if we don't agree with them. Our job is to support their journey, not control it. 11. Reflective listening. Instead of just nodding and saying, "Uh-huh," we repeat back the feeling and the message to show we're really tuned in. 12. Reframing, helping clients see a new angle. You're not overly emotional, you're highly empathetic. Shift the lens, shift the mindset. 13. Interpretation. This is when we gently offer an idea of what might be going on under the surface, like, maybe missing sessions is your way of protecting yourself from feeling vulnerable. 14. Summary. At the end of a session, wrap it all up. Today, we tackled your anxiety triggers and brainstormed coping tools. Recap for clarity. 15. Confrontation only. After trust is built, you might say, "You say you want change, but keep skipping therapy. Let's talk about that." It's not about being harsh, it's about being honest. 16. Clarification. If someone says something vague, ask, "When you said I feel stuck, do you mean emotionally, or like you're literally stuck in a situation?" 17. Probing questions. Help the client go deeper. What's the worst that could happen if you speak up at work? Curiosity invites insight. When it comes to micro terms, we will start with 1. Social justice. This is the heart of social work, fighting for equity, fairness, and dignity, especially for those society often overlooks. 2. Board of directors. They're the decision makers at an organization, approving programs, hiring leaders, and setting the big picture direction. 3. Capacity building. Helping an organization or individual level up their skills and resources so they can grow and serve more effectively. 4. Coalition think team up. Different groups come together to tackle a big issue, like mental health, homelessness, or advocacy. 5. Task force. This is more short-term and focused. Let's build a plan to stop youth vaping in our school district. You get in, solve the issue, and disband. 6. Community organizing. You're not leading the community. You're with them, helping them organize around what they care about. Think grassroots power. 7. Program development. You see a gap, maybe no job training in your city, and you help build a program from scratch to fill that need. 8. Program evaluation. Did the program work? Did it help people? Evaluation helps us figure that out using data, feedback, and results. 9. Policy analysis. Look at a law or policy and ask, what was this trying to solve? Who benefits? Who gets left out? 10. Focus group. Bring a small group together to gather feedback. How was your experience with our shelter? Helps improve services. 11. Feasibility study. Basically, can we do this? Is it possible? Is it realistic? This step comes before launching anything big. 12. Social Security Administration handles disability, retirement, and survivor benefits. Know it well. Your clients will likely rely on it at some point. 13. Lobbying. It is advocating at the government level, directly influencing policymakers. That was a lot, right? But you stuck with it, and that's what matters. These aren't just exam terms. They're the building blocks of what you're about to go out and do in the world. Keep listening, keep reviewing, and remember, you're not just studying to pass. You're preparing to lead, advocate, and transform lives. Let's go. Changemaker.